Welcome to Injector Confidential, a podcast by injectors for injectors. I'm Kristen,
I'm Nicole.
and we are here for another episode. We are loving life. It's a Wednesday, and we have both decided to take a couple admin days each week.
This is a big win.
It's a big win for us. So we're both injecting 3 days a week, pretty hardcore. Sometimes we'll throw a fourth day on a weekend or something, but then really just trying to keep the boundary of 2 days a week of admin, podcast, social media stuff. And it has been lovely.
It's been lovely. And also it's good because we can keep each other accountable to it.
Yeah, it's been great to have the same day off. It's really great for my mental health. So thank you, Nicole.
For sure. Oh, yeah. No, thank you. I didn't even think about taking a second admin day, but I'm glad
Yeah,
that you.
now my days that I'm working are just, I don't do multitasking well when it comes to like social media and
I'm
stuff.
learning that I don't either.
Yeah. And so it's been great. Like my injecting days are full-fledged injecting days. I don't expect anything from myself. I'll have like a few social media posts ready in the queue to go, but I don't do much else other than just inject and give my patients my full attention. And then on my admin days, I can catch up on everything else. And so you did do something very special for me today. And
I couldn't stop staring while we were recording our last bonus episode. I couldn't stop staring, and I thought that Kristen had a crumb that was stuck on her boob. Y'all, it was a skin tag.
which I've been asking her to remove. So I'm well aware of this little friend of mine. It's been bugging me. It's so gross. I find myself playing with it. It's nasty.
It's her pet.
But I don't know whether to be offended that she thought it could either be a crumb or a skin tag, and that there was really that close of a call. But at least she took care of it for me. She lidoed it up, dermaplaned it off. I've got a pretty little Band-Aid here. And
it was really special. And I love her so much. I used my precious Lido with it.
Yes, which we all know is on back order right now.
Oh, yeah, that and the bacteriostatic normal saline, that stuff is
oh my God,
rarer than diamonds right now.
I will sell some nudes for some bacteriostatic saline. I'm telling you what. It is a precious commodity right now. Like, who wants my feet picture?
The bunion picture?
I've got a bunion. There's got to be a fetish somewhere with someone that would pay top dollar.
Oh,
that.
Absolutely. There's got to be someone somewhere.
Okay. We should have taken a picture of my skin tag.
Damn it. Unfortunately, it's in the Sharps container with the dermaplaning blade. And then I just want to clarify, this is not a service that I normally offer. This was bespoke just for Kristen.
I will definitely be advertising you and referring you to all my taggy friends.
But something I was noticing, we were sitting outside eating, such a nice day here in La Jolla. Kristen's hair is starting to grow back from the PRF.
Is it?
Yes.
And is that why I have all these little flyaway things?
Yeah, they're coming back with attitude. That's how they come back.
Oh my gosh. I am so stoked because I thought my hair was maybe breaking.
No.
And that's why I literally look postpartum because I've got all these little crazy flyaways. Oh,
that was less than a month ago.
Okay. And that was only one treatment. So for those of you who are tuning in for the first time, I had COVID a little over a year ago and have since then had pretty much all of the long haul, the non-dangerous long haul symptoms. So taste and smells jacked up, brain fog. I mean, what else is new? And then major hair loss. And so Nicole did a few weeks ago, she did a PRF treatment for me. And so it sounds like the feedback so far is so good.
Yeah, I was noticing in the sunlight, they were looking like they always come back crazy at first.
Oh, I love that.
Yeah, so yours look crazy right now the way that they do when they were growing back. So I had to tell you.
I am for it.
For it.
That is so cool. So we will keep reporting back because I know a lot of my patients got affected by either postpartum hair loss, post-COVID hair loss.
Totally.
So I will be glad to let you guys know how it goes.
Yeah, I'm really excited to see, especially we'll do another one and then we'll do another one in 4 weeks or so. And I think it'll be money. Before you know it, she'll have a head of my hair.
Yes. Oh my gosh. Goals.
Oh, okay. So we've got a banger of an episode ready and queued up for you guys per usual. But this is actually one where I feel like I've just learned kind of the hard way about how important this is. And Kristen and I kind of felt the same way. So we want to share our pearls about patient education. And don't worry, I'm not going to snooze you on this. This is actually very, very helpful tips and tricks that we've picked up along the way that will cut back on the amount of people that text you after the fact the amount of people that have anxiety about normal treatment response, side effects, things like that. And a really nice way to streamline it and fit it into your day to day so that it doesn't take up much time, but it's really effective.
When I worked at a plastic surgery office, there would be times where we would get a lot of calls and either from surgical patients or from injectable patients. And we were always looking for ways to like, okay, well, maybe we need to bring in another front desk person. Like maybe we need to get a separate phone number and all these different like systems things. Once we changed our patient education process, we cut down on the amount of calls, follow ups, concerned clients, unhappy clients because they were so much better educated. And so ever since then, I take this part of injecting extremely seriously. So we have some really good points and pearls for you guys that hopefully you guys can implement in your practice. And with that, Nicole, you want to take it away?
Yes. Okay. So, numero uno, this is not in any specific order, but the first thing that we landed on was being realistic about when to expect results, healing guidelines, and what the timeline looks like for Botox and Dysport. So, we all know what it's like to have that client that texts you. It's 2 days after their Botox. It's me. I am that client saying, I don't see it yet. That's why I use Dysport. Just kidding. Just kidding. Except I'm that was my plug for Dysport.
Sneaky bitch.
Kristen's gonna kill me. Anyways, any wrinkle relaxer, we know it takes 2 weeks, right? To fully kick in. But I think that sometimes as we get so used to rattling off those facts, you say to somebody, it takes 2 weeks to kick in. Okay, like what does that look like? Because people see it start to kick in, but let's talk about how it kicks in asymmetrically. Like for me, my left brow stays sassy, sassy, sassy until day 14. And that's normal, right? So I think giving examples of like what is the normal and telling people it's a true 14-day. What I actually like to do that I find is really a nice safety net is texting my clients at 1 week just to say, hey, do you see it kicking in? And if they say yes, great. I'm like, it's not done kicking in yet, but it'll continue to. And if they say no, it's not done yet, I'm like, that's also normal. Just to know also that I'm thinking about them. And it's a nice little check in. And then I can say, okay, let's check in at 2 weeks too. But when you put a lot of money, I think that it's an investment bias. When people put money into something, they want to see it immediately. And I'm definitely that way. I empathize. So this really cuts down on the after the fact communication. So you're not having to have yourself, or if you have a patient care coordinator or an assistant, you're cutting back and using those resources for something other than what you're experiencing as a normal side effect.
Totally. I think that's a great way to deal with the specific result expectation because I think you're right. I think sometimes saying like, oh, it'll kick in 2 weeks, I think that's too broad for people. And especially first time patients, they've just put a lot of money into something. It's not that instant gratification. I think that setting those expectations very clearly. I love the fact that you texted a week. I think I need to implement that a little bit more. I usually do it 2 weeks, but by that point, sometimes it's too long. I definitely will get even experienced clients that will text and be like, hey, like, it's been a week and like one eyebrow is a little bit lower than the other. And so sometimes I forget that I need to re-educate even my like
That's a
repeat
great
clients.
point. Yeah, because sometimes the side effects that you experience at one appointment are different from the ones that you do at
Totally.
the other appointment, just depending on the day,
Totally,
right?
totally. And, like, sometimes, we're seeing more maybe they're in a season of life where they're, like, seeing more photos of themselves or something where they just did family photos or something, and then as opposed to, like, maybe their last treatment, they didn't, so they're just a little hypersensitive to it. Actually, as we were preparing for this episode, I was responding to an Instagram message from a client who needed a little walkthrough on what to expect for her eyebrows, and it's part of the job. We know that. We know there's always going to be some level of follow-up requires or is required by our patients, and that's what we're here for. But I think definitely setting those expectations is really important. And along with that, when we talk about swelling and bruising,
Mhm.
specifically with filler, the spiel I give my patients when I'm doing filler is that I explain to them what's normal and what's not normal. And I explain symptoms and side effects of like a vascular occlusion, infection, all of that. But then when it comes to just the normal healing process, I tell them, hey, the first couple weeks, totally normal if you feel, some lumps and bumps, if you have one side that's a little bit bigger than the other, all of that's totally normal. We expect that it's just part of the healing process. And as it continues to heal, it's going to get better. If at 2 weeks you're still feeling like there's a level of concern for you, come back and we can address that together.
Yeah, because then they know the door is open
Totally.
and that you're there. And once again, I can't tell you in the past when I've come from practices where it was really heavy on lip filler. And as much as I found that I was getting irritated with people reaching out to me after the fact, I realized I'm probably not doing a good enough job educating. So, with the amount of lip filler that I did, and I didn't always have enough time to do great education, I actually, if people set, like had scheduled for lip filler, I implemented a thing where I created an informed consent about lip filler and pre and post care and what to expect. And
I
I
like that.
and I emailed it to people in advance. And then at their appointment, I said, "Did you have a chance to look over the pre and post care and the healing guidelines?"
And you would just include like swelling
Right.
expectations,
Yes.
like don't drink alcohol beforehand, like
Yeah.
that kind of stuff.
And the whole thing about like it is up to the discretion of your injector to utilize as much filler as they think is appropriate using their professional judgment. If filler is not used at that appointment, it cannot be saved, just really putting it on paper that like we cannot save filler, the risk of vascular occlusion, what normal versus not normal looks like things that are so simple. But I mean, one of the things that I say too is I'm like, swelling can be significant and it is uncomfortable, but it is so temporary. And I can tell you as an extreme bruiser sweller, like I bruise and swell in impressive amount. I just tell people to expect. I mean, just realistic. I tell them it's going to look like you're auditioning for a porno the next day, especially first time lip filler. You know what I mean? Have had some injectors tell me, they're like, well, I just really want to meet my goal for that month. So I just take the person and hope that they don't bruise. Never do that.
Mm-mm.
Always just bring them back.
Mhm.
I've learned that one the hard way where I was like, oh, well, if you don't normally bruise and swell, you'll probably be fine. And of course, they get a total shiner. And then they had to go on a date that weekend and they
Totally.
forgot to tell me about it.
I'll say if there's anything that you would feel uncomfortable having a bruise for, then reschedule. Same with chemical peels. And like if there's
Yes.
anything that you would feel self conscious about having, sloughing skin, then it's best to, because that level of comfort looks different for everybody. For me, my kids are so used to seeing me with like
Totally.
swelling, bruising, sloughed off skin. They don't care. I'll go to meetings. There's very few things that like actually deter me. But for someone else, that could be a parent teacher conference. That could be going to the grocery store. I have some patients that literally don't even want to walk from my door to the parking lot with some bumps and swelling. So I think trying to, because like you were saying, like if we just say, oh, just a special event, then that makes it, well, I don't have anything big going on. I don't have a wedding I'm going to. I can
Right.
do the filler. But when actuality, it's like, well, no, even that first date was enough to make them feel like they walked out with a poor experience. Cause that's what we're in the business of, right? Is the patient experience. And so I think just setting that expectation according to what the patient finds important is key also.
Yeah, and the other thing too, because I'm so heavy on doing wrinkle relaxers, Botox Dysport, gonna bring on Xeomin. It's still on the docket, guys. We're gonna report back about Xeomin soon. But I'm so heavy on wrinkle relaxers that I've started to realize that I need to be better about scheduling people like for a whole year leading up to their wedding.
Yeah.
And then it keeps them accountable because I realistically like, yeah, can you get Botox 2 weeks before a wedding? Yeah. Will you want to? No.
Yeah.
Because personally, for me, like when my Dysport kicks in at that 2 week mark, it is toit.
Yeah.
Like I love it. Let's be real. But like for some people, that's the point of having a wrinkle relaxer feels like uncomfortably almost frozen.
Totally.
And some people are so into that smooth look, other people aren't. So, it's having that rule of thumb of being like, it takes 2 weeks to kick in. I'd prefer if you came in 4 weeks before. Patients really appreciate that. They like honesty and they like you basically anticipating up front. And if you tell somebody no, just because of the circumstances, like don't feel bad. There most of the time when I've had to turn people away because it wasn't the right time for them to get something done, they've been appreciative that I saved them the embarrassment and headache after the fact.
Absolutely. And I always say if it worst comes to worst, I would rather a patient be upset at me because I didn't treat them as opposed to them being upset because I ruined a special occasion
Totally.
for
Yeah.
them.
And then a big part of education too is making it understandable, making it bite sized and making it digestible basically for the client. So I find that language is so important and making sure, of course, we don't need to dumb it down. I think that one of the main things that I find is that people say, well, my clients won't understand medical terms. I'm like, of course they won't. If you just say vascular occlusion, they might not know what that means, but you need to literally say filler can get into an artery, which brings blood flow to an area, can get into a vein, which brings blood flow away from an area. When that happens, just break it down, make
Mhm.
it explain and describe. When I was learning to document in my DNP, they told me that if you don't know the word for something, describe it.
Hmm.
And if you describe it, then you're in the clear. So I've always just taken that forward. I'm like, if you can describe, then people feel like they are included because they understand it. They're invested in the process and it makes it so much more of a partnership. So with education, it's this is goes back to my wrinkle relaxers. But that like heavy feeling that you get at first in your eyebrows, it doesn't usually look heavy. It can, depending on the person's skin laxity, their dose, and their anatomy. But usually it feels heavy. I explain that phenomenon as it kicks in, and I always explain muscles like rubber bands and say that Botox, Dysport, Xeomin, any wrinkle relaxer is loosening up that rubber band so it starts to feel heavy. And then that's how I explain, that's why we treat the muscles around it, because otherwise those rubber bands will start to pull tighter. And when I say that, rather than being like, and this is your frontalis, and this is your glabella, and they talk to each other, it's not as much as that makes sense for us talking back and forth. You just really got to break down that medical speak, and analogies are great. Kristen
Yeah.
was the one that brought up analogies, and I loved that.
I use a ton of analogies. So my favorite one, it's a little in depth, but I use this for my new like full face consults, especially older women that have a myriad of issues. So what I say is that our face is like a table with a well-fitted tablecloth. That's how
Okay,
it starts.
I'm already in.
Yes. So when we're young, our face is a table with a well-fitted tablecloth, right? It fits nicely, it's smooth, it's not wrinkled, there's no stains on it. As we age, not only does the tablecloth, get stretched out, it has stains, it's got wrinkles, but the table itself, so our bone structure actually starts to shrink as well. So we have two issues. And so what that looks like is that our skin or the tablecloth is now loose and wrinkled. And then, so my job as the injector is to help you decide how much of this tablecloth we want to fix. Now, some of this tablecloth, they may have some memories attached to it. Some of those stains, some of those lines, some of those wrinkles, we may not want to get rid of all of them. And some of them I may not be able to fully get rid of unless we cut the tablecloth, and that's surgery. So we have that option. Or we can use filler like cheek filler, that kind of thing to help rebuild the table a bit. So help rebuild that bone structure. Or we can use things like Botox and Dysport to help with the wrinkles of the tablecloth. But then if we've done all of that and if it's nice and tight and the wrinkles are gone, but it's still stained, meaning pigment, then it's only going to ever look so good. And so we've got to still work on the actual pigment and color of our skin also.
I am absolutely obsessed with this metaphor.
Yeah, it's a good one because it
So
really helps people like, oh, okay, there's like mold instead because I think we've all had that patient that's 50 years old. They've never done anything other than worship the sun.
yes.
And they think that just coming in one time is going to fix their problems. And as much as I wish that that was true, and as much as I wish I had a magic wand, the truth is that it's going to take time. It's going to take multiple different modalities. And we as injectors obviously know this, but putting it in a way that they can visualize really helps them to understand like, oh, okay, you're not just trying to upsell me. You're not just trying to convince me I need a bunch of different things, but that each thing that we can offer solves a different problem. So yeah, I found that to be pretty helpful for me. It's like
Love
I said,
that.
it's a little long-winded, but if I
No.
can get the patient to kind of stick with me, and sometimes I don't tell them the whole analogy, I'll tailor it to what I'm specifically recommending for them. Also, too, guys, I'm not gonna lie. Sometimes when I'm looking at a patient and they've come in and I'm like really trying to think through like what I'm trying to do with them, that analogy buys me time to think. And like I can just sort of recite it from rote memory.
Yes.
And then the back of my mind, I'm like, okay, so it'd probably be like 60 units of Botox. And should I do their chin or should I do their lips? Like,
Yeah.
I can like make sort of a little bit of a game plan because so the one negative with working in like a solo type salon is that I can't leave the room. So like
Yes.
in the previous,
There's no place to hide.
there's no place to just go and like think for a few minutes. So you're kind of on the fly. So that analogy does give me a little extra time also to just kind of just wing it, you know?
I absolutely am obsessed with that. That is hilarious. Oh man, I'm gonna take the tablecloth. I've
Yeah.
also heard people describing like Erica Berry. On this podcast, I just seem like her biggest fan, but she's got good content.
She does.
She is the patient education queen.
Mhm.
She's so good at breaking it down and explaining it, but she explains the face like a house. And like, like your face house, like the things that are the most important with like her 8-point lift. And I really like how she explains it. And so she does a great job, like what you just did, of making it relevant because people are like, okay, I know a house foundation. Like I can picture that
Yeah.
because bone structure is so abstract and far off for people, you know?
Totally.
I was writing down this topic and Kristen was like, how do you approach this?
Yeah, and I really am excited for you to talk
Yeah.
about this.
So I am the queen of scaring my clients when I do consents so that they take it seriously. And what I mean by that is that these are medical procedures. Just like you can have in theory, you could have an anaphylactic reaction from Sudafed, Tylenol, anything over the counter, right? But people, we take those all the time because we're out there, they're used, they're FDA approved. Well, things like Botox Dysport fillers, they're also FDA approved. But guess what? There's always a risk that there's going to be, you can have a reaction. And I think too often we get kind of flippant because we do it all the time and we're so excited about the results that we don't talk about the downsides. So if I recommend sitting down and reading line for line, it's boring as hell, your consents that you're telling people. And I actually do, rather than being like, oh, this is your consent for a filler, even if it's a returning client, I educate them. And I'm like, remember that this can happen, this can happen. But I literally go line by line with somebody. I'll be like, bruising's normal. An infection can happen. When infections happen, you can have scarring. And when you have a vascular occlusion, that tissue can die off, and it scares people, but it gets people to take it seriously so that they are invested in the healing process. They take the healing process more seriously because they know that bad things can happen. So where that really comes in is vascular occlusions. And I'm really honest with people. And most of the time people are asking me, they're like, why is migration not in your consent? I'm like, it has a whole nother bucket of work.
Yeah.
People are more than ever are asking me
I
about migration.
totally agree with you.
And it's such an interesting phenomenon. We have to do a bonus episode about migration. I've
Yeah.
got a lot of thoughts
Yeah.
about it. But most people that have gotten filler other places, they come to me and they're like, I've never even heard of a vascular occlusion. I've been getting filler for years. And that to me is terrifying because that is just such a risk that, it's something real. It's like we were talking earlier, the more clients you see, you will inevitably at one point have an occlusion.
Mhm.
Knock on wood, I haven't had one yet, but it's important to have your bases covered so then at least somebody can be educated enough to say,
Right.
hey, that whole white lacy thing, or I have a bruise that's getting bigger. And you can say, yeah, send me a picture.
Right.
Because otherwise they might just write it off as normal.
Okay, so I have two questions for you
Yeah.
as it relates to this episode. So, one, does that ever scare a patient away enough where they decide not to do filler?
No,
Really?
never.
Okay.
Yeah.
Even when you do like tear trough and blindness and all of that?
Yeah.
Okay. And then do you feel like when you educate them on what to look for with the vascular occlusion, do you feel like you end up getting more like nervous Nellies texting you later asking you like, well, what about this? Does this look like an occlusion?
I actually have less.
Really?
Yeah. Yeah. Because they know because I afterwards, I'm like, this is normal. This is normal. I also point out with people, I'm like, I bruised you here.
Yeah.
You're swollen here. Like, so then they know. I think that also helps too. But I think knowing the worst case scenarios somehow takes people's anxiety down.
That's interesting.
It is.
Okay.
It's a
I might
weird,
change that
it's
process.
a weird phenomenon. It works for my clientele. It may not work for everybody's. But I will say that when I tell people the downsides of tear trough, it usually does push them into the PRF territory.
Yeah, that's true.
And I'm fine with that.
Yeah.
Yeah.
I took my verbiage from being when I would be in pre-op with plastic surgery patients. I would listen to the CRNA, give informed consent all the time. And so she would talk about like basically in the realm of anesthesia, she would say like anesthesia is relatively safe. We do it all the time. However, with that does come risks and complications. Would you like to hear more about those?
Oh, I like that.
And then usually the patient, that's a lot of times what I would say. Like we do, Botox and filler for the most part are completely safe, but with any medical procedure comes risk of complication. Would you like to know more about those? And sometimes patients will, sometimes they'll say yes. Sometimes they're like, nah, it's fine.
But then it buys them into that. So it's like, no, like, yes, they did sign the consents. We want to make sure that everybody knows the consents are signed,
Right.
but
Oh,
that
yes,
you don't have to, but they're
absolutely.
basically foregoing you walking it through A by A, B, C. They still
Yes.
sign it and you
Yeah.
do say these are the things you're signing for. But that's so interesting because it does partner them in psychologically too.
Mhm.
Oh, I love that. I'm learning how to be a better injector on this
Yeah,
podcast.
but now I'm like, gosh, like, maybe that's not enough, like,
No,
because the piece
that's way more efficient. God damn. I can really cut
yeah.
down on my appointment time.
Yes. I mean, I think that I think the efficiency piece, but I do think at the end of the appointment, I do tell them like this is swelling, this is bruising, this part should go down, this is okay. But I do think sometimes at the end of the appointment, it will get rushed. And I feel like I should do a better job of explaining, like, again, signs and symptoms of infection, signs and symptoms of an occlusion of just kind of, and I do give my new patients like a handout,
Yeah,
like with like a
I do that
call
too.
me if you see these things. But yeah, so that's interesting. It's interesting to like, here we are years in and still trying to rework our practice.
Yeah, and it seems a little callous, but I do mention to people that these are elective medical procedures. They're not necessary. They're elective and they are cosmetic.
Mhm.
So, with anything that's elective, there can be complications the same way that if there's something that's medically necessary, there can be complications. And so, I have to make sure that you know about them because otherwise, I'm not doing my job as a provider, right?
Right. And part of the informed consent is knowing that they know that the patient knows that there is that alternative to not do it.
Right, exactly. That's exactly. See, I love this pre and post op energy that I get from Kristen. She's so freaking thorough. I love it.
I mean,
And then we kind of touched on this, but especially for new clients, I think it's really nice to have a written aftercare handout that you gift them with their ice pack. We have these nice little cute lip shaped ice packs. I give them that.
do.
And if I don't have it printed out, I email it off immediately after their appointment, a handout about this is normal, this is not normal, this is what to contact me about. This is a great thing to delegate out if you can get somebody to create it for you and make it cute on Canva and put it on a little postcard. It's great. I actually took this idea from my friend Bree that does the microblading because she has an emotions card about eyebrows
Oh my
with
gosh.
little emojis about
Like the
the
process.
healing process.
Oh
Yeah,
my
you
God,
know,
people do that with lips.
yes. And so I took that
Oh,
because
I
that was
really
like,
love that.
because there are so many emotions involved when you invest in, and especially with lips. I was telling her, I was like, this is just like eyebrows and lip filler are like pretty much the same.
Totally.
They have shock. And then by the 7-day mark, they're like, I miss how dark my eyebrows were. You know, same thing. I
Totally.
miss how big my lips were. So she was like, people do better when they have it written down and in front of
Absolutely.
them. They tape it to their wall, whatever, their aftercare. And so I took that and I think that it really does help. My thing that I do now is I have a full on Retin-A guide. I call it
I should.
a Retin-A user guide on how not to fuck it up. And it literally has your starting schedule, what you can and can't do on it, what to expect, what's normal, what's not normal. And I don't have anybody text me anymore about being shaggy dog
Yeah.
with their Retin-A.
Which is like when I am like a hardcore ZO person, and like that was the biggest thing because whether I had them on Tret or the wrinkle and texture repair, like inevitably, no matter how many times you tell them in the appointment what is an anticipated reaction, they just our emotions get the best of us and they
Totally.
wonder if we're having an allergic reaction and all of that. And so written guides, huge. I also had a written guide of exactly how to use the products, of what order and all of that, just because that is another huge piece, a huge component of what my patient follow up entails for sure. So I think the next thing that we have found useful is blocking enough time for pre and post care. So I'm a pretty quick injector. People that work with me know that I can bust patients out pretty quickly just
She
from
really can, but like with shocking accuracy.
this is like a maybe a little off topic, but this is how I run an appointment with a returning client. So I usually in the chart will have written down personal details if I by chance I can't remember them. So maybe that they went on a vacation, what their husband does for work, how
Oh,
many
it's so
kids they
important,
have.
that psychosocial aspect. Always
Totally.
write it down.
So I usually will bring them in for their appointment, do a super quick, like, how's it going? Like just a quick little check-in. Then be like, okay, how was everything last time? We debrief. Okay, this is what our plan is for this time. I get everything set up. And that's where I'm going over, like, okay, so just a reminder, like, Botox takes 7 to 10 days to see a full effect, 14 days before I would bring you in for a touch up. This is what to expect with lip filler. here's what to expect for your appointment today as they're numbing, as I'm getting things ready. Any questions about that? Sign your consent. We've done the before and after photos. We can all take a collective breath at that point once we get started. And then once we get started, then that's when I'm like, how's Amy doing? How's your daughter? She had that recital.
Mm.
And it takes their mind off things. It allows for there to be this like natural start and stop of a conversation. Because otherwise you kind of get sometimes some chatty Cathys that just want to keep going. Once you're done injecting, it sort of brings the conversation to a natural end. And then at that point, I'm cleaning them up. I start to transition into, okay, so here's where you're a little bit swollen. Here's where you have some bruising. I'm going to have you ice today, put some arnica on. You can take Benadryl tonight if you're feeling like you're really
Oh
swollen.
my God, I love Benadryl for swelling.
Yes,
It is a hidden gem.
totally. And then I'll usually say, feel free to reach out to me at any point. However, 2 weeks is where we would talk about doing a touch up. Any questions for me? And then that's when, if they're a return client, they don't usually check them out. They're done.
Oh my
So
God, that's so
that's
efficient.
kind of how my appointments go.
I need to point out because I've never seen this before. Kristen injects her Botox one-handed.
Which is so funny because I'm trying to I'm watching other people inject now. I'm like, I guess that isn't
No,
super
I
common.
told you, my left hand is always involved. It's always a two-handed job with me.
Maybe it is because I'm left-handed.
But it's honestly, it is so seamless and graceful. Whereas me, I feel like a gorilla sometimes injecting because I need that second hand. But I do sometimes use my like left hand to like pinch really hard to
Like, I
distract
do
them.
that. I do.
To distract, especially with like an introducer or something.
Hmm.
But I feel like when I saw Kristen do that for the first time, I was like, this is incredible because that right hand is just like floating all angelically with the gauze. She just looks so professional.
Oh my gosh.
And then there's me.
Stop it. I do utilize my old labor and delivery like breathing techniques with patients
Yes, you
all
do.
the time.
Yes.
All the time. I'm constantly watching their breathing and always like reminding them to take a breath in. If they're really nervous, I'll actually
Mhm.
count for them, like walk them through almost like a mindfulness activity while I'm injecting.
And then she says, okay, where can I send your invoice for your therapy?
Yeah. Ah,
I take cash or credit.
yes. Venmo, please.
Venmo, please. That'll be an additional $165 to your visit. Yeah, she really like you are such an efficient injector, and totally admire that. I mean, my clients know I'm like a little bit chatty, but I do find that the best time to chat is while you're getting drawn up.
Yeah, and I feel like the chattiness, like, helps them feel connected to you. I
Totally.
feel like that is, like, where the patient loyalty lies.
Yeah.
So I don't think that's a bad thing by any means.
And I've always drawn up in the room, and I know that some people have like a different prep room, but I truly feel like my experience with having prepping the product in the room is that patients actually really like it. They like to see they're getting the real thing.
Mhm.
They like to see where it came from. And I think that it's like cool to see like how it comes together. So
Well, and how many patients have you gotten that are, like, they've come from somewhere else where they're not happy, and they're like, "Yeah, my Botox didn't work," like, they probably dilute it. I hear that so
I'm like, well, I
often.
dilute mine too. That's
Yeah, I know, it works.
exactly.
They don't get like, well, if I'm drawing up in front of you that it's like, the real
Yeah,
thing.
yeah,
Whatever, like, they don't
totally.
get it enough to know that like it's the same
Yeah,
situation.
the
But
smoke and mirrors is kind of good that way. You know what I mean?
totally, it just allows for some transparency for
Yeah.
sure.
Oh, absolutely. And then Kristen and I were talking about this. Kristen's been really good about this. I've been trying to get better, but scheduling a 2-week follow up for anyone who's new.
Yeah.
Also, can we talk about how healed before and after is so much better than a fresh off the needle?
So much better.
Yeah.
Oh my gosh, game changer for your before and after photos, which that's going to be a whole other bonus episode.
Yeah.
But, I think that it's done a couple things for me. One, so let's be real, it gives an opportunity to upsell. So say you just had a Botox patient that came in, a brand new patient. I scheduled them for that 2-week follow-up. I'm ensuring you, because obviously in the consultation process, we're talking about other things, skincare, filler, microneedling, all of that. So at that 2-week follow-up appointment, it gives me another opportunity to say, hey, so we talked about doing cheek filler. How are you feeling about that idea? And they're usually like, oh, I thought about it. Like, do you have time to do it today?
Yeah.
And so it gives me that opportunity. But then also too, I always tell them like I'm available by text or Instagram message within that 2 weeks. But if it's not something emergent, just write down your list of questions and then I'll see you at your appointment. So it helps alleviate their anxiety during that 2-week mark. And it definitely takes down the amount of texts and calls I get because they know they're going to see me in a couple weeks.
Yeah, it totally I love what you said about it being almost like a transition sale where it's very organic that then they say, I thought about the cheeks and I think you're right.
Mm,
They've had a solid 2 weeks to think about it. They're coming in and they want those cheeks, man.
totally. And by that point, the Botox is kicked in. So they're feeling pretty good about themselves. They're ready to do something else.
Totally. And I actually love seeing people at 2 weeks too.
Totally. And financially, it's a little bit of a less of a blow if
Mhm.
instead of telling them, well, your total's $2,000 if we do all of this today, it's somehow a little bit easier for a patient to be like, okay, well, I'll pay $600 today for my Botox, even though it's the same amount of money. But
Breaking it
two
up,
weeks
it's
later,
psychological.
totally, they're
Mhm.
like more willing to pay that $1,400
Right.
all by itself.
Well, it's kind of like a cash advance. They see that cash advance up front of like what Botox did. And they're like, oh my God, I can only would imagine what filler would do.
Exactly.
That's why I also love pre-scheduling people for their next appointment.
Yeah.
If you can remember, do it because then it puts them on the books and they can always reschedule it, right? But then they never forget an appointment.
Do you give them a discount?
I do. Yeah.
Yeah.
I have a pre-booking
Yeah,
discount
same.
to reward people for thinking ahead.
Yeah, same. Because I think it really does make a difference. Honestly, from an injector standpoint, not only does it promote patient loyalty, and then also too, you're just having them come in. Because we know too, like the best results are going to be if they come in every 3 to 4 months.
Yeah.
So you're improving patient satisfaction, you're improving patient loyalty. But honestly, for those of us that are like trying to build our books, you're relieving some of your own anxiety because you're looking and you're like, oh, okay, like I'm starting to get patients booked in June. Like I don't have to worry that, oh my gosh, another month's come and my schedule is empty.
Right. Yeah, that's a really good point.
I also get a lot of messages of like, when should I come back for my next treatment?
Mhm.
And instead, it's nice to they just know I already have another appointment booked. They can bring it up if they need to. And
Yeah. And it helps prevent that thing of, I need my Botox tomorrow. Well, I'm booked.
yes,
You know what I mean?
totally. And then they could go like, well, I'll just go to whoever has the next opening.
I know, knife to my heart. No, thank you. Do we want those clients?
No,
I want the ones that are diehards.
that's right.
That's right. And we both have pictures of ourselves that we show people to show rather than explaining. Explaining and describing is great, but showing the progression of swelling and also what it looks like in a healing process, the process of a bruise getting better. I mean, I love my pictures because I always look so busted
Mhm.
after filler. And then they see me in person. They're like, you look okay. You know what I mean?
Totally. I love showing my Kybella like progress photo.
God,
Be-
Kyle is
Oh my
hilarious.
gosh. I'm like, yeah, you're gonna look ratchet for a while.
So Kristen in December, we did threads on her, PDO threads. And after that, we were feeling so good about like how snatched she was. So I was like, okay, let's do how many rounds of Kybella had you done at that
I had
point?
already done 3, but I gained weight and bitches be damned. I still had my double chin. So this was my 4th.
Yeah. So then we did a 4th round of Kybella, but it was so funny because we went to a provider journal club and our medical director was there when we did the threads and she looked like so lifted and snatched after the threads. And then she comes in with this like frog neck.
Full frog.
With like full bullfrog. And he goes, well, what happened?
It's like, you messed me up.
I know. He was like, well, you were so lifted and just now you're not. I was like, Patrick, shut up. God.
The Kybella, man.
I know it did work great, but yeah, that's a
Great.
great progression to show because it's impressive.
Totally. And it just makes it more relatable. And I think it just shows your patients like, hey, you know what? I'm not immune to the swelling and bruising process. Like it's unfortunately just the price you pay to have the end result. But-
Totally.
So our next point would be that we really recommend pointing out their asymmetries as part of the consult process. And the reason for that is that I've always been taught that if you point out asymmetries before you inject and you're able to say like, hey, when you smile, this side goes up higher, or this, your cheek's a little bit flatter on this side. When you point it out before filler, it's education. When the patient comes back and they're complaining that there's something asymmetric, at that point, if you point it out, even using before and after photos, it's an excuse.
Love
And
that.
yeah, so pointing out beforehand is education. Pointing it out after filler is just an excuse in the patient's mind. And so I really recommend taking the time to show them in the mirror, show them in their photos, take a video if you need to, and really, really nail it into them that, hey, this is a pre-existing asymmetry. A lot of times filler can make those more noticeable. I definitely chart to that fact to either remind myself or just kind of cover myself in case the patient comes back with a complaint about it. Very rarely, hardly at all, really, unless there's like maybe some body dysmorphia, do I have a patient that comes back and complains about a pre-existing asymmetry when I have gone over it with them.
Oh, never.
Yeah,
Yeah, never, not unless there's something else psychological going on there. It's also kind of funny though, because there's a certain way to point it out to people. But when you say to somebody, you're like, well, actually, the entire left side of your face is higher. Like it always makes them laugh because you're like, well, look at me. Like, I'm asymmetrical too. We've all seen those things too, of like when it's like the perfect symmetrical face and it looks scary.
totally.
Yeah, asymmetry is what makes this beautiful. But inevitably, when you add filler, it makes any asymmetry more visible.
Totally.
Yeah, the bane of my existence for a little while was Fortis spots on lips, and
Mm.
how when you add filler, they become more visible because usually they're on the wet border, and when you
Yep.
stretch it out, they go to the dry border. So it just we all have an aesthetic eye, but use that to your advantage to really point it out to them. It will not hurt their feelings. I promise you, we are all a little jacked up by nature.
Totally. And I'll usually preface it by like, okay, we're going to be injecting your lips today. So I ask for permission. I say, is it okay if I point out to you a couple things that I'm noticing about your lips?
Kristen is so much nicer than me. I just go in gung ho. I need to start asking for permission.
That way they can't be offended. Like I
Yeah,
asked you, you said yes. So suck
that's
it
on
up.
you at this point.
Yeah, suck it up, buttercup.
Oh my God, I love that. I'm gonna start doing that because usually I just go in all guns ablazing, hot. I'm like, yeah, you see this? That's because this site's higher.
Maybe it's just because I'm a tender little peach. So I
Oh,
need someone to like finesse me a
I
little.
do. I do tell people though, I'm like, I'm looking on this street, like nobody would notice this about you. You're in my chair under
Yeah.
my unflattering light. I notice these things because it's my job. And even on the street, unless somebody is like truly botched, I usually don't notice those things because otherwise it's exhausting for my brain.
Totally. And I always joke with them like, there's fluorescent lighting in here for a reason. Like,
Yeah.
the before photos are not meant to make you look your best.
No,
So,
definitely not.
yeah,
Yeah, and so I love the fact though, if there's one takeaway from this with pointing out asymmetries, before the treatment, it's education. After, and it's an excuse. I'm gonna have merch with that on it. Kristen Dozy, quote by Kristen Dozy. Uh,
Oh, it's so true.
Another Erica Berry thing. She said that every patient should have your phone number. I kind of disagree with that because, like, your personal phone number. I disagree with that because I need to have a clear line at the end of the day when I'm not answering calls anymore unless it's an emergency.
Mhm.
And it's harder when it's a personal line to distinguish that, where when I'm actually just trying to catch up on text at the end of the day. So I say have a Google Voice. We have Open Phone, which is
I love open phone.
Open Phone's a great app. If you can invest in it, it's amazing. Have a dedicated line that people can contact you. If they know the door is open before that 2-week follow up and they need to contact you, then they're less likely to hit you up. It's reverse psychology. I don't know
Totally.
what it
Yeah.
is, but then they can contact you with the "is this normal?" question.
Mhm.
And then they're not blowing up your DMs. The other thing that's great about Open Phone in particular, I didn't use Google Voice to its full advantage back at my old practice, but with Open Phone, you can have an automated message after hours saying, "Hey, you've reached my voicemail box," or whatever, like a text message
Mhm.
voicemail. And it says, like the one that Kristen and I have says, "If this is a medical emergency, please call 911."
Yeah.
That sounds dramatic, but like truly that's what you do, right? If you have an emergency, you go to the emergency room. But then you can see it. You can kind of screen if it's a true emergency. But if it's just somebody saying, "Hey, I'm still bruised and it's day 10," and they're like, "Is there anything else I can do?" Then you can decide if you want to tell them, "Hey, this is Nicole. You can take some arnica," or you can see if you want to wait till the next day if it's 7 p.m. on a Saturday. That's up to you.
Mhm. Yeah, a lot of times I'll get people that are just like, "Oh, what specials do you have?" Or something like that. And I'm like, "Oh my gosh, like it's 7 a.m. on a Sunday."
I
Like,
know.
so it
I
allows
woke up
me.
thinking about you.
Oh, yeah. Yes. And so,
So do I. It's
like
okay.
Ah, Nicole's, like, the only person that I can, like, without any hesitation, text at, like, 5:36 in the morning, and
We're
I'm
both
like,
up.
"She's awake." So, it's
Yeah,
nice.
we're both on Canva. I know we
Yeah.
are.
I think that's when probably when we're the both mostly the most productive, like, that's when I go through all my text messages, like,
Yes.
so
Nighttime's a no-go for me.
yeah, oh my gosh.
No.
Heck no.
I think the nice thing too about all of these little tips about patient education is it totally streamlines your day inadvertently. It streamlines your communication. And it's truly about getting in the practice of doing these things. At first, you might feel like they slow you down because you're not used to doing them. I promise you it will pay off in the terms of patient happiness, patient satisfaction, patients being invested in the process, and also just transparency. I think it's a great thing to just base your practice off of.
Absolutely. And just keep in mind too, like what we always want patients to feel like is that they're not coming into our practice to buy a product. They're not buying the product of Botox. They're not buying the product of Juvederm. It is not a commodity based service. They are paying for our education, our expertise. And so the more of the education piece that you can give, that's really what is going to set you apart from these discount injectors in your
Totally.
area. And you're going to make them you are going to be the expert in your field and you're going to prove that to your patient.
And they will never go to anyone else.
It's true.
It really truly does set you apart. We really hope that you guys found this helpful, and, take it or leave it. Everybody makes their own practice work for them. We come from, running, I call it the Wizard of Oz, like a one woman practice. Like I'm a one woman show,
Yes.
but you can also loop in your support staff too and include them in this process also to make that delegating that service work for you also and work to your advantage and making patient education improved as well.
Absolutely. Well, until next week, guys, thanks so much for tuning in. As always, please rate, subscribe, all the things. Follow us on social media. We would love to connect. If you haven't messaged us already, just to say hi, we would love to connect
We
with you
love
in
it.
DMs. And don't forget, we have our Woman Crush Wednesday where we shout out injectors doing amazing things. We would love to know what you're up to. So feel free to message us with all your big and beautiful things, and we will feature you on next week's feature.
Yeah, we
Have
want
a
to
great
hear
week.
from you. Yes. Have a great week. See you guys.
Bye.